Lots of people I see with sleep problems also have teeth grinding or bruxism. Is there any link between those things?
Look, it's an area that's looked at a lot in dentistry, because there are people that do think that bruxism or clenching and grinding is linked to sleep apnea, because you do find a lot of people with sleep apnea clench and grind their teeth, much more so than you expect in the public. And the same of people who clench and grind, a lot of them have got sleep apnea as well. So there is a lot of speculation about there being a link, but at this point in time, even though they coexist, you can't say one really causes the other.
Yeah. I also see people with insomnia tend to get a lot of clenching and grinding as well.
Yes.
So just finding clenching and grinding to me doesn't equal sleep apnea. It might equal a sleep problem, but not necessarily sleep apnea.
Yeah, and interestingly, that stress has been looked at a lot, and anxiety, depression, and people who have a history of clenching and grinding are no more anxious or depressed. Okay. However, times when they're going through difficulties in their life and they're more stressed, definitely their clenching and grinding is worse, and that's often where people start to have problems with bruxism.
Yeah. So what problems can bruxism cause?
There's three main problems that are caused by bruxism. First of all, the clenching and grinding just overuses the muscles of the jaw. So you've got muscles, it's called the masseter muscle, temporalis muscle, they're the main clenching muscles, and they're designed to be resting most of the time. So if you're doing a lot of clenching and grinding during the day or while you're sleeping, you're going to get pain in those muscles. So typically headaches, tension type headaches, jaw pain. A real telltale sign is waking up in the morning with pain. Yep. Morning should be a really good time where you're feeling refreshed, and if people have got pain, you have to wonder about bruxism.
Yeah. And what about the teeth themselves? Can it cause problems?
Yes, so that's the second thing, is that teeth. So some people just clench, and there's not too many problems with tooth wear, but a lot of people actually grind their teeth, so their jaw moves side to side, particularly when they're sleeping. And while you're sleeping, there aren't those what's called protective reflexes, so people can do a lot of damage to their teeth. They can really wear through teeth, put cracks in them, and break teeth as well, break dental restorations. And so that's a big problem, is destruction of teeth. And the third problem is jaw joint problems. So we have a joint in front of the ear there, it's called the temporomandibular joint. It's a small joint, and if people are clenching and grinding a lot, it starts to become inflamed and painful, and people start getting what's called temporomandibular joint disorders, and it can become very painful, chewing and opening and just moving your jaw.
Yeah. So what can people do if they're having trouble with clenching and grinding?
Yes, so because the clenching and grinding is what we call centrally mediated, it comes from the brain, so it's very difficult to try and prevent it. Yes, so there are dentists that are using Botox for clenching and grinding. Look, in my hands, I just don't think it's necessary, because I think you can overcome the problems. You can't stop people clenching and grinding, but you can stop that excessive clenching and grinding, which causes a lot of the problems. So, I mean, an obvious one is wearing a splint. So you've got we call it an occlusal splint. It goes over the teeth like so, and it protects the teeth. So it doesn't stop people clenching or grinding as such, but it's great for protecting teeth and fillings. If people have spent a lot of money on their teeth and restorations and porcelain and implants, it's really excellent for protecting them. And they can be really comfortable. And you can see one like so, which is very thin. This is computer made, and I've been wearing one for a long time. I might show you what that looks like. Just slips in over the teeth like so. You can open and close and talk, and it's really quite easy to use. Yeah. And it's a great insurance policy for protecting the teeth. I mean, I don't use this now because I use a different device which does the same thing, but it holds the jaw forward and it gets rid of my snoring as well, which is more of a problem for my wife. Yeah. So that's one thing you can do, and it can be very valuable, and they're really comfortable. People adapt to them in no time, and you wear them quite easily for the sort of medium term. Another thing that I talk about is resting the jaw during the day. So there's two sorts of bruxism. There's nighttime while we're sleeping. There's not much we can do about that. But there's also daytime clenching. A lot of people don't realise that teeth are not supposed to touch at all during the day. If you're not chewing food, the teeth are meant to be, and the jaw's meant to be in what's called the rest position. Just like you are now, there's just a gap between your teeth. You feel that your teeth aren't touching at all. But a lot of people don't realise, particularly when they're concentrating or feeling under a bit of stress or time constraints, they've got their teeth together. Doesn't mean they have to be heavy duty clenching or grinding, but just having your teeth together for long periods of time means these muscles are working when they should be resting, and these muscles are holding up the jaw. The lower jaw is quite heavy, so if you've got your teeth together, these muscles are working and it's putting pressure on the teeth as well. So one of the things that we do, which I've found extremely effective, is what we call awareness therapy, because people aren't aware that they're doing it.
Yeah.
So if I suspect someone's doing it, they've got symptoms of bruxism, I'll ask them if they think they're doing it, and some people say, yes, I do it all the time, it sort of feels normal to have my teeth together, and other people say, look, I don't know. And I say, so I show them where the jaw is supposed to be, and I'll often come back in a week's time and they say they can't believe how much of the time their teeth are together when they're not chewing food. So one of the things I say is just to put your fingers just under your cheekbones, just where the main clenching muscle is, and just have a bit of a clench. When you feel that muscle kind of switch on, so that's called the masseter muscle. And so the aim is just to relax that muscle. So let that muscle just soften and loosen. And as soon as you relax, the jaw just drops down. Now, one way of doing that is if you say the letter M, and just leave everything where it wants to be, and that's it. That's the rest position. It's important to get that rest position where there's no tension at all in muscles at all, because if you tell people to rest the jaw, they'll often put something between their teeth, some tissues or whatever, and the aim is just to let all muscle tension go, let the jaw just flop loose, and that's the rest position. So just saying the letter N or M can just but obviously you don't want to go around during the day saying M, but after a while you get the hang of where the jaw is just meant to relax. And often people find they just keep on catching themselves doing it, and they can get really frustrated by it, but over time, maybe a month or so, all of a sudden they're starting to get good results, and they're starting to feel better, the muscles are more relaxed, and there's some evidence that the more you do it during the day, there's a carryover effect to nighttime as well.
And what about other strategies like hypnosis or meditation? Do they have a role?
Yes, so there is some research on meditation, relaxation, and so that's what we do with our patients as well. We give them a CD, and we actually work on an app now, which is just like a muscle relaxation. And there's some evidence that if people do that for say 10 minutes before sleep for about a month or so, it just translates into less clenching and grinding. So that's something that people can do just before sleep. And there's also a track in this one that we give people during the day. So just to practice that relaxation. And when I tell people to say that letter N and just let everything relax, often I'll say, and just do a mini relaxation, just take a few breaths, let the shoulders and neck muscles relax. And often people develop quite a bit of insight that the times they've got their teeth together is when they're really kind of frustrated. It might be a mother-in-law might be around, or it could be a boss or something like, and they start to recognise that this is having an effect on their body, maybe not just their muscle, but maybe their tummy and maybe their pulse rate as well. So it just starts that whole recognition of what stress can do to the body.
Great. Thanks a lot, Harry.
Okay, thanks, Dave.